Hello, everyone. This is Alex. So, I'm a nurse practitioner. I work with Dr. Young. Some of you already know me from the clinic. So, I'm going to be talking about Hashimoto's thyroiditis today. As some of you know, I do see a lot of patients with hormones. It's my specialty. We really see a lot of women in the clinic with hormone issues, and thyroid is one of the hormones that is so important for the function of the body. And hypothyroid, low thyroid function, it's very common in this country. So some people, when they have a whole hormone panel, one of the things that we find is low thyroid function, which can make you tired and gives you several symptoms. But one of the other conditions that we find very common in women is Hashimoto's thyroiditis. So then the question comes, some patients ask me the question, but Alex, what's the difference between hypothyroid and Hashimoto's? What's the difference? I have Hashimoto's, so that means I have low thyroid function? No, those are two different things. This is what I try to explain to patients. Sometimes we do a whole thyroid panel and we test for all the hormones of the thyroid, T3, T4, we do the TSH, and we also do thyroid antibodies. And we end up finding that people have this autoimmune disorder, which is called Hashimoto's thyroiditis. That means that you have inflammation of the thyroid gland, inflammation of the thyroid tissue. The inflammation is chronic and it can cause, long term, if it stays inflamed long enough, it can cause your thyroid to start to produce low levels of thyroid hormones. And then you start having low thyroid function. Then you can have Hashimoto's with hypothyroid. So even though sometimes you hear those words used interchangeably, people think that they have Hashimoto's, they have a hypothyroid. It doesn't necessarily mean that way. So I like to treat these things in separate ways so people can understand. So if you have Hashimoto's, basically what that means is that you have an autoimmune disorder. That's what's the issue here. This is what we need to treat. You have an autoimmune disorder. And what that means is that you have a dysregulation of the immune system, and the immune system is confusing your thyroid gland with an enemy, and it's trying to fight your own thyroid, which is not good. So it's mostly, it's about 8 times more common in women than men. So that's why we see a lot of that in the clinic. So the literature, most of the research papers, they say that the cause, it's really unknown. It could be genetics, why some people have more autoimmune disease than others. It could be environmental toxicity, exactly what kind of toxic element, we really don't know. And there's another theory that says it could be caused by viruses. So that's an interesting theory, because some autoimmune diseases today we know that can be caused by viruses. So that's one of the theories about Hashimoto's thyroiditis. The theory goes like, your body is exposed to a pathogen. Let's say you have been exposed to Epstein-Barr virus and mononucleosis, one of those viruses, and your body goes in full action trying to take care of the problem and kill the virus, and take care of the pathogen. So once the job is done and the bacteria, or let's say the virus, is gone, your immune system doesn't stop. It keeps going. And instead of stop the fight, keeps going and start damaging your thyroid tissues. And that happens because there is a white blood cell that we call T-reg cells, the T regulatory cells. So the T regulatory cells, they're responsible for your immune system, to tell your immune system, to advise your immune system to stop the fight. Everything's good. Let's go back to normal. So there's this dysregulation of the T regulatory cells, or you have low T reg cells. And then what happens, you have this chronic inflammation of the thyroid that if left unchecked, you're going to have low thyroid levels, T3, T4 levels. And because of that function, now you have low thyroid function. Because of that, people come in the clinic and they start complaining of, they tell me, I'm so tired, I'm very cold all the time, I have muscle aches and joint pain. This is an interesting symptom because you normally don't see that symptom listed as a symptom of Hashimoto's, but I have seen patients in the clinic where they tell me, I can barely let people touch me because I hurt so bad. My joints hurt, my muscles hurt. So that's kind of like a common symptom that I see with a lot of women. Irregular periods, of course, because your thyroid regulates your periods, and because your thyroid regulates your estrogen or your ovulation, then you can have also fatigue, brain fog, even depression. Depression is a common one too with hypothyroid. Cholesterol, elevated cholesterol. When people say, oh, my cholesterol is horrible, my doctor wants to put me on some sort of cholesterol medication, I always say, before we do that, let's look at your thyroid function, because it could be that, and we need to treat the cause. Weight gain is very general because it could be hypothyroid, it could be because of the Hashimoto's, could have many other reasons, but it comes with that too. Like I said, brain fog, because you have inflammation. There's a chronic inflammatory response going on that it just happens to affect your thyroid tissue, but people feel very tired with this condition. So what kind of tests we can do? So a simple blood test that we order, of course, we have to order the TSH, the T3, the T4, but there's two main tests that I normally like to test all my patients, and is the anti-TPO antibodies and the peroxidase antibodies and the thyroglobulin antibodies. So those two tests, if elevated, it tells me if you have a chronic inflammation, if you have a chronic inflammation to your thyroid. Sometimes the numbers are it's supposed to be below 40 or below 34, 35, depending on the lab. I see patients with numbers very high, 2,000, 3,000. So depending on how is the inflammation, what's happening, the treatment, it's going to be a little different. So it's interesting because I've had a lot of patients in the office telling me that they have been diagnosed with Hashimoto's, but they were told that there's no treatment, there's really nothing to do. And then if they have normal thyroid function, if they have low normal T4 and T3 levels, nothing is done. They're just left untreated, and those antibodies don't mean anything, they were told. So normally what we do is we try to see if you do need hormone replacement, meaning if you need T3, if you need T4, then we need to replace those hormones, of course. But in the long run, you have to remember, if this is an inflammation issue, if this is an immune system issue, then really what we need to do is to focus on your immune system and see if we can help your immune system to go back to its normal function. So one way to do that, of course, is diet, right? So diet, it's like number one for everything. And one thing that we find to be so true for Hashimoto's thyroiditis is you really have to avoid all processed foods. You need to start eating a whole food diet. And I always tell my patients, I feel that most people respond better and have better results when they eliminate all grains, not just gluten, but grains, meaning corn, rice, oats. For whatever reason, the protein in these grains seem to be similar to certain viruses. So if you just eliminate that from your diet, then your immune system can forget the infection, let's say, and start to calm down and start to behave as it should. So that helps One thing that I use if the situation is really hard and if the patient has other autoimmune conditions, because a lot of times you have patients with Hashimoto's along with other autoimmune conditions. Sometimes they have celiac disease. Sometimes they have lupus or other things. So low dose naltrexone is something that we use. It's a prescription medication that we use in as the name says, low dose. And the main purpose of this medication is to help the T regulatory cells to do its job, to start functioning in the body and tell the immune system to calm down. There's nothing to be, worry about here. Alpha lipoic acid, when used in conjunction with low dose naltrexone, it's very helpful because alpha lipoic acid is a antioxidant, is a precursor of glutathione. So it helps to oxygenate the cells. It helps to clean up the liver. It helps all those inflammatory markers to decrease. So it's very helpful. The dose will depend on the patient. Everyone is different. We have to use the dose depending on what the other markers of the blood work shows. And iodine, it depends. Iodine, it's yes and no. It really depends on what levels are we talking about. If the antibody count is too high, it really depends, and along with other markers of the patient's blood work. So I'm giving you the references of some studies, the latest studies that they review all the information about Hashimoto's thyroiditis. So it's not a condition that it shouldn't, I don't think it should just be left alone and nothing be done about it. Because if you know somebody or if you do have Hashimoto's yourself, you can tell that you don't feel good, even though sometimes you've been prescribed Synthroid or levothyroxine and you're still not feeling good. So we have to really try to see if we can get your immune system to react in a normal way. So Synthroid can be used. Some doctors like to prescribe that. We can also use natural thyroid medications. And sometimes you don't, like I said, sometimes you don't need to be taking necessarily a prescription thyroid. What you need to do is to fix your immune system, and then your thyroid starts to behave in a normal way again. All right. So I hope this was helpful, and we'll talk again.